For me, where the journey started was my grandmother passed away from breast cancer. My mother is a 2-time breast cancer survivor. She and I are both BRCA2 carriers, so BRCA2 mutations that increase people's background risk of cancer. And that was what initially gave me interest in the space, and starting to ask questions about, are there things that can be done that are different so that you don't find out that you have high risk many years after the fact, until you've gone through multiple diseases and loss in a family. The early days of Color really grounded around the cancer genetics and the link between cancer and genetics, and how that can affect management of cancer across broad populations. But over time, really the kind of core incarnation of the company has turned into what we call a virtual cancer clinic, which was something we started building about 4 years ago, actually really coming out of the pandemic, but with the realization that there is both a need and an opportunity to just rethink how we approach cancer in a more kind of holistic and global manner. Employers in many ways are, many people call them almost like the first responders in people's cancer journey. Oftentimes I hear from benefits leaders that literally they find out about a person's diagnosis even before people tell their family members. When someone is diagnosed, their employer is one of the primary anchors for that journey in terms of the need to support people going through it. By and large, the biggest impediment for someone getting a basic screen that's covered is not that they're afraid. It's not that the financial, etc. It is literally the friction of access. It's every single step that people are made to take causes attrition. There should be a way to just make it extremely frictionless for the patient and very cheap for the system. And I think that's a very, very big promise, especially for the population management side of cancer. Late-stage cancers are going to start looking more and more like chronic diseases, where it's not a single, very costly episode. It's not a car accident where you kind of get through it and then hopefully you recover and then you're done. It's a beginning of potentially decades of needing to manage a disease. We historically had viewed cancer as it starts with diagnosis and ends when you leave the cancer center. And the reality is that every cancer story starts decades before the diagnosis and continues, hopefully, decades past it. Employers fund about half of American healthcare. They have a long time horizon. I think a key part with everything that's around, life level health, is that short time horizons. Employers can have decades-long relationships with people. Employers are not just waiting for a solution. They are a fundamental part of that solution. No one has both the financial incentive, but also the moral authority to make that difference. I'm Othman Laraki, and I'm one of the voices of NEBGH.